Hi, I'm Dr. Todd Cooperman, president and founder of ConsumerLab.com, which has been testing vitamins and supplements and all kinds of health foods since 1999. And I'm here to talk about our latest tests of CBD products. This is all in our report on ConsumerLab.com, where we have specific results for each of these products in terms of how much CBD is in there, how much THC. And I want to also point out that this is our second time we've tested CBD products. The last was in 2018. These were tested in 2020, and the market has changed, and I'll talk about that and give you a quick overview of what you should be looking for and be aware of when using CBD. Note that all the details are in our report on ConsumerLab.com. For our members, that's what funds our research. We don't make any money selling products. So to jump right in, first of all, what is CBD? It's a compound found in cannabis. Cannabis can either be marijuana, which has a high level of THC, a psychoactive compound, and a lower amount of CBD, or from hemp, which is what these are from, which is another type of cannabis where CBD is higher, THC is lower. And actually, it was the growing of hemp was legalized in 2018 with the Farm Act. That actually seems to have increased the supply of CBD, which has significantly decreased the cost of CBD. Comparing our recent results to those in 2018, we found that the lowest cost for good CBD from a product has fallen about 70% from what was about 80 cents to get 10 milligrams to now about 25 cents to get 10 milligrams. That's been a real change in the marketplace. Another interesting thing that we found is that in 2018, many of these products contained significant amounts of THC. They weren't very high, but enough that it could trigger a drug test for marijuana, a urine test. The products now in general, not all of them, have removed most of this THC. In fact, we found that levels were undetectable in most of these products. So there isn't as much concern now about testing positive if you're using the right products. What you should look for on a label, and I won't always tell you exactly how much CBD or THC is in there, but what you should look for is either the word CBD on the back of the label in terms of the actual amount of CBD or cannabidiol. It may also say the amount of hemp extract, which is a more general term, which will contain CBD, but you don't really know how much CBD is in there. And another kind of intermediary term is phytocannabinoids, which includes CBD, THC, other cannabinoids. And so you don't know exactly how much is there either. But all those words are kind of code words, meaning that there is probably CBD in the product. Again, if they actually say the amount of CBD, like some of these do on the label, then you should know what they're guaranteeing and promising. What you don't want is a product that just says hemp oil and nothing about CBD, because hemp oil is from the seeds of the hemp plant. Seeds are not where you get CBD. It's from other parts of the plant, such as the leaves. So it's just seed oil, hemp oil, that you're not going to get CBD. Although some do use hemp oil as a carrier and they've added CBD to it. So just be aware of that. In terms of what CBD does, the market is still way ahead of the science on CBD. CBD has been approved as a drug. It's called Epidiolex. It's approved for people who have rare types of epilepsy, mostly children. It's used in hundreds and hundreds of milligrams in those people. These products tend to have anywhere from, we found about 2.5 milligrams in some of the creams and lotions. They also had maybe up to about 7.5 milligrams in those creams and lotions. But in the oral products, about 5 milligrams up to 50 milligrams of CBD. So much lower than the hundreds of milligrams that people are using at a prescription level, and at which most of the clinical studies have been done. So CBD has been shown to have some benefit for pain, but again, that's at higher levels. And also it's been shown to have benefit in terms of anxiety, possibly schizophrenia. The evidence is not as strong at all at these lower levels, although many people do say that they have a benefit from it. But really, a great deal of research still has to be done to prove that in any kind of clinical setting. CBD can also cause Side effects, typically more when you're dealing with these hundreds of milligrams, where in addition to abdominal and GI issues, which can occur even with these lower amounts, people have other more significant effects. There are drug interactions, blood pressure can be reduced, heart rate can be increased. But again, you don't see that so much with the lower amounts, the kind of tens of milligrams of CBD. You get more common are the GI effects. So in summary, it really pays to shop around when you're buying CBD, to read labels carefully. Look for the keywords like CBD or cannabidiol, preferably. Look for products that are low in THC, either saying THC free or less than 0.2 or 0.3% THC. Certainly, you might want to look at our report for our members on ConsumerLab.com, because there we actually have shown exactly the amounts of CBD and THC that we found in these products, and also show you which is our top pick in terms of getting CBD at high quality and low cost. Thanks very much. Again, this is Dr. Todd Cooperman with ConsumerLab.com.